All right, so the intention is to keep all webinar participants informed about COVID-19 science and what's happening, to help you and your family stay healthy. And then the webinar is motivated so that you actually can create an action plan, adjust your action plan, and also help your broader community. So my goal is that the people that attend one or more of these webinars then become the informed people in their community and can kind of spread the information that they get here. So I wanted to start off first with what I thought was very interesting, which is the new mask. And it's a new mask that actually, it was set up initially clear in the center, and it was set up this way for sight disabled people so they could read the lips, but it's actually very good in general, because often a lot of times with the mask, people can't see your smile. I know in emergency medicine, I used to have to tell some of my patients that I really am smiling underneath this mask. I think it's a really, I haven't ordered any, but I'm going to. But I think it's really good for people to see us and our personality despite COVID-19. So I found these new masks, and I saw somebody out today with this clear mask for the first time ever. So I just wanted to point that out before we actually really got started. All right, so let's talk about the reopening. All right, this is quotes from Dr. Fauci from the Senate health hearing that just occurred recently on July 30th. And basically, he said that new coronavirus cases could go up to 100,000 cases a day if we do not actually turn it around. We're currently at about 45,000 cases a day, so we're currently at about half of that. He also talked about the swine flu or the swine virus they're seeing in China. That is breaking out in the pig population and infecting those that work in the pork industry, but so far there has not been any human-to-human transmission. So in general, we have had a surge of cases in the month of June. And as we talked on this webinar, we said that as we reopen, particularly if states reopened before they saw the 14 days of decreased cases, that we would see a surge of cases. So we've had an increase of about 50% in the month of June. This is actually really, really important given that we have the 4th of July weekend coming up this weekend. So if you actually look, the New York Times did something and they looked at each state and where are they. The dark blue are states that have reopened. The light blue means they're sort of in the process of reopening. They've relaxed some things, but have not relaxed other things. The kind of brownish, light brownish means they're pausing. And then the gold color means they opened up, and I would say they opened up too fast, and now they're actually having to take a step back. And those states are the main states that are actually causing the problem, specifically California, Arizona, Texas, and Florida. So let's talk first about California. The graph to the left shows the 3-day moving average of California all the way up to June 30th. And as you can see, it's essentially a straight up graph. They have opened up retail, food and drink, including bars in some counties. Now they just recently in 19 counties actually made a reversal on that. They've opened up personal care, houses of worship, which I think are going to actually become very problematic. Casinos in some counties, museums, galleries, zoos, aquariums, bowling alleys, arcades, and all of the theaters, which are also in some counties going to be very problematic. Gyms, manufacturing warehouses, and all their TV and movie production. Texas is also a case where we've actually seen it actually go up. Originally, Texas did open up their food and drink, and they've recently closed it. Specifically, they've closed the bars, but they did not close restaurant indoor dining, which I believe also needs to be closed, and limited to only outdoor dining. But Texas has opened retail restaurant, dining, personal care, houses of worship, entertainment, outdoor recreation, and industries. Florida, which shows a particularly high spike, they have open retail stores, again, restaurants as well, all sorts of personal care, including tattoo salons, massage therapies, tanning salons, acupuncture, houses of worship, entertainment, beaches, gyms, and trails. Arizona. Arizona has actually closed movie theaters, gyms, water parks, and bars. So all of these states are still doing indoor dining, and they're all still doing houses of worship. And most of them have the casinos open, which is also problematic, as well as retail stores and pools and spas. Now, I want to show you the graphs of some states that people are not talking about, which I think is very important. The first one is Idaho. Now, many people may be surprised by seeing Idaho, which is such a rural state, have a graph that actually looks like this, but Idaho has several meatpacking plants. So Idaho is actually has a graph that has dramatically gone up since about the middle of June. Another state that people are not talking about, but I think they do need to talk about, is Nevada. Now, Nevada opened up their casinos. Originally, the masks were mandatory for employees, but not mandatory for patrons. They have since actually switched it, so now it's mandatory for both employees and for patrons of the casinos. Another state that no one is talking about that's causing some problems is South Carolina. You can see the graph here for South Carolina. It is going up very dramatically. Georgia, you have heard some talk about Georgia, but the focus has really been on Texas, Florida, Arizona, and California. But Georgia also has a very problematic graph and was one of the earliest to really open up. And as you see from this graph, the Georgia graph never actually really went down. It kind of flattened a little bit, but they actually never waited to go down before reopening. All right, so I want to switch a little bit and talk about COVID impact on the brain and some of the long-term effects of COVID. So specifically, one of the things that we're seeing is that in younger and middle-aged people, we're actually seeing strokes from cardiovascular events, basically from the clotting problems associated with COVID-19. In addition, we're seeing a lot of long-term complications that include dementia and confusion, chronic or generalized weakness, strokes as we talked about. Pulmonary fibrosis is like a scarring, so the lungs get very stiff. You can also get a pulmonary infarct, which is almost like a heart attack of the lungs. But both of these kind of lead to afterwards difficulty breathing with normal things like maybe walking a block or something. And then also because of some of the vascular diseases, some of the clotting, we're also seeing amputations, right? So there's going to be a lot of long-term COVID complications. Nick Cordero from Hamilton, as some of you may remember, he is in the ICU. He's still in the ICU. He's been in the ICU now for, I think, close to 100 days. They're saying that if he is able to survive, that he is going to need a double lung transplant. So the long-term sequelae of COVID-19 are significant. So in that context, we have to look at what are we actually doing around our healthcare and our healthcare insurance. So it's interesting to just 2 days ago just yesterday on July 1st, Deep Red, Oklahoma voted to approve Medicaid expansion under Obamacare. What they did was they did it as they have a Republican governor and a Republican House and Senate. So they did it as a ballot initiative. So as a ballot initiative, the majority approved it. I think it passed narrowly. It says there 50.5%, which would now send a Medicaid expansion bill to the governor to sign. At the same time, on a federal level, the Trump administration has asked the Supreme Court to actually invalidate the Obamacare law and actually also scrap pre-existing illness protections. All righty, that is what we have for today. So I am from there going to go to Q&A. Holly, I'm going to let you take over. If you have any questions, you can put them in the chat box. Let me see if I can get back to see everybody. Here we go.
There are currently no questions in the chat box.
All righty. If anybody wants to talk, you can unmute your hand and we will, you can raise your hand and we will unmute you. If you want to actually ask a question verbally and Holly, hold on just a second. What I'm going to do, Holly, is I'm going to promote you to host. So you can take people off of mute and again, you can still put anything in the chat box, but I see somebody has their hand raised. Okay, looks like we have a question from Deborah.
Hi, Dr. V, we're Deborah. Hi,
Hi.
I'm in Jacksonville, Florida.
Okay, how are you?
I am well with the NAACP Health Committee down here at the Jacksonville branch.
Yes, yes, and you guys have had a lot going on down there.
I know, that's why I wanted to definitely be here tonight to hear what you had to say for us. What should we be saying to our community statewide, and especially in Jacksonville, because I'm over the health committee for the whole state now. And we're trying, do you think we need to be having some webinars? Do we need to have you piped in sometime? Or what should we be doing to help get our minority community up? Some of our doctors have associated themselves with the NAACP, the Urban League, to approach the city for some of the CARES funds to do extra testing locally, closer to our neighborhoods. And so we're trying to get that because people are waiting now 4 and 5 hours to get tested.
No, I've seen the lines on TV. So a couple of things. One is because you guys have a 5-alarm fire down there, okay? And we can't bring a teaspoon of water to a 5-alarm fire. So let me give you a couple of things that I think actually would be really important. So one is the city or county leaders that are NAACP affiliated, I would get those political leaders on a webinar so that we could go over what are the things that they actually need to do by executive order. Okay, because they have some power to do things location-wise, so that way areas where there are African-American leaders or leaders who are concerned about the African-American community can actually step in and do things. So that would be number one, right, is to get those leaders on a call to go over what sort of executive orders they could actually do. The other thing that would be important, the issue with the testing is that they have actually put a limit on the number of tests that the federal government is going to reimburse in a particular 24-hour period. Okay, so that's why the line, so when they get to, let's say they have 1,000 tests that day, they can get to 1,000 tests by 11 o'clock and then that's it. Okay, so on the testing front, you actually really want to look at who is a donor or someone who actually may actually get behind this cause and write a check for you guys to actually set up testing sites, and then we could actually do that, right? You would probably have to do the same thing, a certain number of tests per day, maybe do it by appointment, or something where, so people aren't waiting in line, you know, for long periods of time and they have a different experience. And then for the community, we need to, because I'm sure if I came down there to Jacksonville, I would probably still see people in Jacksonville walking around without masks, right? Without the things that
yes, and yes.
Yeah,
especially
right.
At
Exactly.
the beaches, they're just all
you're right. And so part of it is like, for people to actually realize, and then some people don't actually know what symptoms, like because it's been touted as a respiratory disease, a lot of people don't realize that there's so many other symptoms other than respiratory that they actually need to watch out for. So you could do some, you could do a community webinar, or, everybody you're part of the healthcare task force, have the healthcare task force do a webinar, and we do a webinar on, what do you need to really do? You know what I mean? What I find really works is that I don't actually talk to people about what they shouldn't be doing. I just kind of talk about what works, and then let them gravitate to what they actually want to pick up and actually make a part of their lifestyle, right? And I think a lot of times people think too, well, if I catch it, I catch it. It's no big deal. A lot of people don't realize the sequelae that are associated with it. Yeah, but Deborah, I mean, we in Jacksonville, you all need to, well, in Florida in general. I mean, it's, and the other thing is that I've noticed that your governor of Florida is nowhere near doing anything. Like he's, Texas, I mean, at least today at 5 o'clock finally said masks are mandatory. But your governor he's been clear that he's not going back on anything. He's not closing anything. He's not mandating masks. He's not going to do anything.
Dr. V, you now have a question in the chat, and it is, can you please review again the cautions against alcohol?
Wait, can I review now what?
The cautions against alcohol.
So what? So I need to know what the person means as far as there's a couple. So let me just go over a couple. Okay. So one is bars in general. Really, you can't socially distance at a bar, right? And so the bars specifically need to be closed because people just automatically are sitting close to each other, talking to each other, almost usually talking face to face to each other. The other thing about the bars is that in general, as you drink, you become a little bit more lax. You know what I mean? You may be very careful and then suddenly you're not. You know what I mean? So as people actually drink more, they actually are less conscious of what they're doing and not doing. And lastly, alcohol in general lowers the effectiveness of your immune system. So that is the other thing that happens with alcohol. So for all those three reasons, you know what I mean? But if you want to drink alcohol at home, and whatever impact on the immune system you have, but at least you're not actually face to face with other people. There was one person at a bar in East Lansing, Michigan, that actually infected 80 people. So the bars are really, really significant. So there is an outbreak in East Lansing specifically related to a bar. The other thing, unrelated to the question, but almost all of these places had houses of worship that they allowed to be open, and singing really sends a lot of particles in the air for very far and very long. So does, and I don't know exactly what you call it, maybe you can help me, Holly, when people, the pastor says something and then you say it back, or he reads
the call and response.
Yeah, the call and response, thank you, yes. So the call and response where people are speaking in unison also sends a lot of particles in the air. And so, a church service where you're doing call and response and you're also singing is extremely dangerous.
So you have one question in the chat and one person who has their hand raised. Which question do you want to go to first?
I'll take the one in the chat first.
The one in the chat is, how can Disney World open safely?
Let's see here. I don't think it can. Let me see. I don't, so one, you're outdoors, which is great. The only way I could see Disney World opening safely is if they literally, you know, you have people getting off of a ride and coming right on a ride, getting off a ride and coming back on a ride. So they would almost have to get off of a ride. Oh, excuse me. They'd almost have to get off of a ride and then actually have a cleaning crew come in and then get on a ride. And then, you know what I mean? They'd have to almost have everything cleaned before you had the next group of people. So I don't know if they're able to, I don't know, add more cars to the various rides. I think there's some rides like the water rides that would just never be safe. The water parks and stuff, if they're water rides, you're not gonna be able to make those rides safe. They could also limit the amount of people they have in a park at a time, and require masks. So let me just say this. I want to make sure. So the protests that we had for George Floyd and around Black Lives Matter and police brutality, those protests have not seen much of an outbreak of COVID-19 because the majority of those people were wearing masks. So masks make and if you saw on TV, they were wearing masks, but a lot of them were not maintaining the 6 feet distance apart. So the masks are really, really, really important. So they've been looking for outbreaks from the George Floyd protest, and we have not found a significant outbreak from that yet.
The next question is someone who has their hand raised. Danielle Smith.
Okay.
Hello, good evening, everyone. How you doing, Dr.
Hey, how are you? Good.
I'm fairly middling. So I wanted to ask you, do you have a plan for how we should plan for school openings? What measures should the schools take in order to open? Because I hear some of them want to open when school starts back, and a lot of people are apprehensive. So
yes, so I wanted to add this to this slide today, but I was so busy with all the other slides. So let me just say, so one of the things is I'm combing through the data on what the various countries are doing. So what I'm adding next slide, next week, once I actually get through all the data, is I'm going to actually show here's what New Zealand is doing around schools, here's what South Korea is doing around schools, here's what China is doing around schools, etc. Right? But in general, the general gist of it is that what they've sort of done is almost like lengthened the day so that some kids might go to school from 7 to 1, and then other kids would come in and go to school like 2 to 5, you know, however you would, wherever the middle would be. So maybe I didn't actually, but kind of like, or some kids might go to school Monday, Wednesday, Friday, and other kids might go to school Tuesday, Thursday, Saturday, right? That I know is some of what I've seen. But I'm just starting to read some of this literature, and I haven't gone through it all yet. So I will have more details on the school openings next week.
okay, thank you so much.
Yep.
The next question is from the chat. If you had to predict, how soon do you think we will see states completely shutting down again versus pausing? Today, the Ohio governor announced that the past 14 days, there have been 1,500 cases, which surpasses the CDC's daily high of 100 cases per day.
Yeah, I think that we are going to see, I think we're going to see states close down completely, or at least, well, I think close down completely, probably by the end of July. With the lag time that you're looking at, the lag time is about, it's about 3 to 4 weeks. So these 40,000 cases that we're seeing a day now, these folks are going to really be sick by the end. They're going to be sick probably by the middle of July, but they're certainly may really be sick by the end of July. So what happens is when someone gets sick with COVID-19, just like the Nick Cordero person, he's been sick now for 90 days, right? And then the new ones come in, and the discharge rate is so slow that it begins to actually accumulate. So then once it begins to accumulate, then you have to have, so there's a lot of talk about the ICU beds, and are the ICU beds, are they full? Do they have extra ICU beds? But what's more important than the ICU beds is the staff. So you can increase, you can make a closet, you can make a closet an ICU bed, right? But you got to have a nurse and a doctor to work that patient or that group of patients, right? So one of the things when you saw the Mercy ship and those big ships come to New York to help out, and the reason why they didn't stay very long is those ships do not have critical care. They don't have critical care staff on them, right? So those usually when there's an emergency, like for instance, when I was in the Virgin Islands, the Army, the military brought in all these additional medical staff to help us at the hospital because the hospital had been hit and the community had been hit very hard by Hurricane Maria and Hurricane Irma. Well, they sent in family practice docs, and it was an emergency department. So if anybody was really sick, we still had to take care of them. So they didn't really decompress our load that much. And so COVID patients are all really sick, for the most part, the ones that come into the emergency department. And so you've really got to have critical care. You've really got to have critical care trained physicians and nurses that can give the staff that's working now a break, because they're not getting a break, right? And so you're gonna have to probably shut down these states probably the end of July, beginning of August.
Right now, there's no more questions in the chat or hands raised.
All righty, I'll give people.
Wait, we have one more question.
Okay.
Okay, have another question. This is Danielle.
Yes.
So there's a problem. I see it. I mean, I have a son lives in Houston and family all over the place. They are out at the barber shop. They're going to the gym. They are doing everything. And the young people seem to think that they are invincible. A lot of these young people don't even know if they have an underlying issue until they actually get sick. How do we get the correct, because now they're saying on the MSNBCs and the CNN said they are not, because they don't look at them. So they're not getting the right information. How do we?
What do you mean they don't look at? Wait. What do you mean they don't look at what?
So a lot of the young people are not looking at the news stations, the news outlets, to getting their information. They're getting it from friends saying it or bits and pieces off the social media. So how do we work on getting the right information to them? Because one person on MSNBC said, "Listen to your parents," but they're not listening to us.
No.
So.
No, I think that the best people to reach the young people are young people that have actually been infected by COVID-19. I really do. I think that if the young people who have been infected by COVID-19 actually speak up about this, I also think what would be important is for people to really talk about the other risk factors other than age. Yes. I find the news really focuses too much on age. I thought our young folks would not do well because we have such an obesity problem, right? So we have a real obesity problem with people that are young in America. So anyone that has a BMI over 40 has a risk factor, just like somebody who has a BMI over 40 is going to actually present almost like somebody who's over 65. Okay. Right. And so, one thing that I think is important is people need to say, wait a second, if you're obese and then you also have diabetes, hey, you join the group. It doesn't matter if you're 19. It really doesn't. Wow. Well, it doesn't matter. Right. And so when you see the folks that are, when you see the younger people that are dying, they're male. And the same thing as men. I'd also harp on the fact that men are more likely to get it and men are more likely not to do well. And so I think that we really have to get the message out, because the news is really making it seem like, it's just the older people. It's not us. When I say us, right. I think that young people really have to get the message out to each other.
Awesome. So my last question is, how are the young kids faring when they do have COVID? Like, what is their survival rate? How are they doing? Do they just go through it and they get better? What is
so it really kind of depends. So the newborns are not doing particularly well, right? Mm. So we're seeing now in Texas where they've created a ward specifically for women that are COVID positive and delivering, right? The preemies are not doing particularly well with COVID-19. When the kids are, 1 and more, then they're doing better with it. So it kind of really depends. And then again, you have young kids who have asthma. You have young kids who might have cystic fibrosis. You see what I'm saying? You have young kids that have diseases that would actually put them at increased risk, sickle cell anemia, right? You have young kids that actually have diseases where they are also at risk for not doing well.
Is there a difference between the kids who are breastfed compared to the kids who are just on Similac or formulas?
I haven't seen that. I don't know. I'd have to look. I haven't seen any study related to that. So I don't know yet.
Okay, I'm just thinking because they had their parents' antibodies and all that kind of stuff.
Antibodies,
So
yeah. Yeah.
Okay.
Yeah.
Thank you so much.
You're welcome.
You have 2 questions in the chat.
Okay.
One question is, how do we get enough medical personnel with the visa restrictions?
Very good question. So one thing is, I think that I think that the visa restrictions need to be relaxed. But if they're not relaxed, they could also provide incentives for people that are retired to actually come back into work. That would be a very good group that they could actually utilize, but they would probably have to provide some incentives for them to come back. They've also actually been looking at, they've upped the responsibility of some of the senior residents and senior medical students, but that's not going to really give you the staff that you need. I think the real way to do it is to actually incentivize the retired physicians and nurses to come back.
And the second question is, what are your thoughts on college campuses planning to reopen?
Yeah, so that's part of my school thing too for next week. I've noticed that NYU in New York City is going to come back. I saw a couple of other schools that had said they were going to come back. And so I actually am trying to research, what are they going to do? Some of them have said that they're going to spread out the desk and they're going to make the classes smaller and they're going to do things like that. So I actually, for next week, I'm going to actually identify certain schools and look up their plans and add that to the presentation. I believe in general, though, that older kids should be able to social distance. The issue is that the school has got to be really clear with some of these kids who are kind of taking it as a joke, that is not going to be allowed. I do think they need to have a mandatory mask policy. Some of the younger kids now are having COVID parties where, the first person, they're charging $10 or $20 to come to the party. And the first person who gets COVID then gets the pot, which is crazy. But they started doing this, and in the state of, they started doing this in Alabama. And so they're going to have to make some of this stuff where, listen, if you do this, we're going to come in and arrest you, literally, because it's very, very irresponsible. So I think the schools are going to have to really set up some criteria and some policies on campus such that people have consequences if they don't follow them. But I'm going to add that in, trust me, next week I'm going to do Tuesday and Thursday on schools, because there's a lot on schools.
The next question is, someone has their hand raised, so I'm going to unmute them.
Okay.
Hi, Dr. Val. This is Manju in Ohio.
Hi.
Hi, I have a question for you. So we have some close friends. She's actually a nurse, and a relative of her, actually her niece, she's 3 or 4, was at their house on the 21st, which was a week ago Sunday.
Mm-hmm.
And that Thursday, that 3 or 4-year-old niece tested positive for COVID.
Okay.
When she was at their home, she had no symptoms, no runny nose, nothing. I think it came on by Tuesday or Wednesday. So then Thursday, they took her to Children's ER. She tested positive. So
Right.
the whole house has been quarantining. And then she texted me today because they have 4 kids. Their youngest is 10 months. And his test came back negative. So, and she's like, nobody in their house has had any symptoms. She's actually, believe it or not, been going to work at Ohio.
Oh, no.
She told her boss, not at the hospital. She's in an office, but they're like, fine, there's no symptoms. Take your temperature, which I was really shocked.
Right. Right.
She's like, so far everybody's been fine. And, I don't know about everybody else's, but the baby's test came back negative. How long? Is it only 14 days they should be quarantining, or is it longer than that? Because isn't there kind of like a shedding process too?
Yeah, so they need to quarantine for a minimum of 14 days, whether or not their tests are positive or negative in that time frame. So I don't know if you were on Tuesday, but we interviewed 2 contract tracers, and the contract tracer from New York actually spoke about this, right? So she specifically said that, because I said, well, what happens if my test is negative? Can I go? And she's like, no, 14 days. So one is you have to tell your employer that you're on quarantine, and I'm on quarantine for 14 days, and the whole family needs to stay in for 14 days, whether or not they're positive or negative. So 2 is when they're doing contract tracing, they're doing contract tracing from, they initially were doing it 2 days before you turn positive. New York has now actually increased it to 7 days before you turn positive. So like quarantining all the contacts in the previous 7 days. I personally think they need to quarantine everybody from the past 14 days. But they were in New York quarantining people from the previous 7 days. We have found now, and there was just an article that just came out, so the amount of asymptomatic spread of COVID-19 is now estimated at as high as 30%. And when I say asymptomatic, they could be asymptomatic for the entire 14 days, or they could be asymptomatic for like pre-symptomatic, and on the 14th day they become symptomatic. But it is as high as 30%. And so I think that's so like, for instance, D.L. Hewley was just talking about it. He's like, oh my God, he was on TMZ. He said, I had no idea I was Typhoid Mary. He has, most of his management crew has become COVID positive. And he was going around, giving comedic shows, right? So it's very, very important that they actually stay in for the 14 days, no matter what their test results show, and not go to work.
So I think other than her and her husband and the kids, but now, I mean, even though the results came back today and their 14th day and is it 14 days from the time that the positive person was at their home, or 14 days from when the person tested positive?
14 days from the time the person was at their home. So they haven't hit the 14 days yet. You said that was
Saturday, the 21st.
Yeah.
So, and they know, they're pretty sure, like 99% sure where she got sick from. There was at another friend's house who didn't know they were sick.
Right.
To find out.
Right.
So, and then what is like that whole shedding process? What were you saying, 14 days minimum? What should be the maximum?
Yeah, so 14 days minimum, maximum 21.
Okay.
That was the study from WA, Italy, where they tested the whole city.
Okay.
And they did 14 days for all the positives. And after they did 14 days for all the positives, they still had some people who were still shedding, and they tested those people. So testing is the key, right? Because if you test those people and they're still positive, then you send them back in for another 7 days. We're not doing that. We're saying at the end of 14 days that you're just done, and which means we're missing the people who maybe need 21 days.
Okay. All right. Thanks.
Right. Okay. All right. Thanks. All righty.
You have one question in the chat. Do you want to take this as your last question since you have to be done by a certain time?
Yes, because I do have a call, another Zoom meeting that I have to get on at exactly 9 o'clock. So that would be helpful. Okay, great. What do we have?
Last question. Do you have any guidelines to classifying patient risks having COVID, i.e. low, medium, or high risk based on the symptoms of coughing, sore throat, or diarrhea?
Wait. Read that again now. You mean how likely are they to have COVID based upon those symptoms?
No, ma'am. It says, do you have any guidelines to classify patients' risk of having COVID, low, medium, or high, based on the symptoms of coughing, sore throat, or diarrhea?
Yeah. So that really varies by local jurisdiction or area, right? So for instance, if I were to go, like I've seen the reports out of Texas, they're seeing 15 to 20% of their symptomatic patients that are actually positive. If you go to some place like New York where their cases are going down, you'll see maybe 6 or 8% or 5% where they're positive. So it really kind of depends upon the area that you're in. We haven't quite figured out why some people actually develop respiratory symptoms and then other people develop GI symptoms. So we haven't quite figured that out. So I don't have any sort of risk stratification around that. And initially, some people with GI symptoms were not being tested. which was, so those cases were at the very beginning actually being missed. No, we don't have, we have risk stratification around, around risk factors. So we know which risk factors are more lethal than others, right? So we're very clear that like the most lethal ones are respiratory disease, cardiovascular disease, obesity, and age. Those are the four that are, I've seen cancer patients who are immunosuppressed beat this if they're not overweight. I've even seen them over 60 and beat it. But when you have a multiplicity of risk factors, if you have 2 or more risk factors, your rate skyrockets as far as lethality of this disease. So, but I don't know as far as symptoms because it varies. Some people have a lot more in their community than others. All righty. Well, I want to thank everybody for joining us tonight. Like I said, next week we're going to focus on the schools because I think it's very important to know and then kind of make a decision, well, what am I going to do with my kids if things reopen and they're not having the criteria that I want to have for my children at that particular school. So I will share best practices from Australia, New Zealand, South Korea, and China on schools next week, Tuesday and Thursday. All right, Holly, thank you for hosting this. I really appreciate all your help. And thank all of you all for coming. If you have any questions, feel free to put it in your comment section or send me an email or reach out on your invite and anything that you would like to hear about on any of the upcoming webinars. So thank you much.